for this last person. Good afternoon. My name is Dr. Cindy Baumbaker, and I'm board chair of the Scattergood Foundation, and I want to welcome all of you, leaders of the behavioral health community, and you, somebody who will probably be our potential next mayor, here this afternoon. And I just wanted to talk a very little bit about the city of Philadelphia and get us geared up with some Philly pride. We are a city of firsts. We had the first bank, the first insurance company, the first daily newspaper, the first public library, the first steamboat, the first turnpike, the first what? The first radio station, the first TV station. I will not be the first proud mama to tell you that we also have Comcast's new show, Bob, Breakfast on Broad Street, which is the first daily regional sports talk show in which my daughter is one of the hosts. You can get that on TCN and Comcast Sportsnet. I'll tell you the times during the break. The first law firm. Philadelphia had the first labor organization. We were the city that had the first protest against slavery. We had the first university, the first medical school, the first hospital, and the first private psychiatric hospital, Friends Hospital, which began in 1813 when Thomas Scattergood had a vision that he wanted to bring here to the city of Philadelphia. And we led the way in the moral and compassionate care of the mentally ill. It started here, and I want it to continue here. Our city of brotherly love was first in compassion. And today, we are doing the first mayoral forum to take a look at the state of behavioral health, both socially and economically here in our city. There's a challenge here, oh, Mr. or Ms. Mayor, and we want to know who will lead us to be the first compassionate city in the 21st century. We are a city of firsts, and you have the opportunity to continue Thomas Scattergood's legacy. William Penn said, "Let there be love. Let us see what love can do." And we now add, let us see what the commitment of the people in this room can do, along with good science, solid funding, smart policy, and a good CEO. So please, Mr. or Ms. Mayor, make behavioral health a priority. Thank you, and here's Joe Pyle, our president.
Thank you, Cindy. Again, I want to welcome all of you, and it's good to see a packed house. So first of all, I want to start by thanking all the Democratic candidates here today for their service currently and for what their service will be in the future. I want to also thank the partners that made today possible. I want to thank the Alliance for Community Service Providers, the Council for Children, Youth, and Family Services, the Committee of 70, WHYY for the use of this space and their technical support on this, and Children's Crisis Treatment Center, who hosted an event this morning on children's recovery and adverse experience. Is it luck or something else? So those of you who were able to attend, I think, got a real great opportunity to see the talent that exists in the Philadelphia region and why I think we can become the next great city based on trauma-informed services. So by way of a little bit of background, prior to this event, the foundation and its partners had a set of papers commissioned by Philadelphia's experts on child welfare, behavioral health, substance abuse, intellectual disabilities, and autism, trauma-informed care, recovery model, prevention, and economic impact. And all of those papers are available to be downloaded from our website. The candidates then also had an opportunity to come and meet individually, one-on-one, with those experts to work on educating themselves and being informed on the topics that we think are so important. The Foundation and our partners believe that today is the first of what we think will be many transparent and public conversations about the issues of health and human service. And I want to challenge us a little bit here today as we think about an election. Individuals that have benefited from these services outlined in these papers have been called patients, clients, and currently we call them consumers. As of today, I'd like to think about them as citizens in a democracy that must do better. I strongly believe that the next mayor must be a leader of all citizens, no matter how vulnerable, that he or she must work to break down the silos, prioritize health and human services, so we can truly become a great city. I would ask that all of you think about folks as citizens, as individuals that need to be protected and cared for. I took a minute to look up the definition of citizens this morning. And if you give me a minute on my iPhone here, if it accepts my thumbprint, I found it to be striking in that a person, so here, where is it? I should have been more prepared on this. A person owing loyalty to an entity by birth and naturalization to the protection of their rights. So I think citizen is the term that we should use not only as we enter into this mayoral race, but as we think about it in the future. So that I would ask that you make a commitment to think about this in that way. The Foundation is committed to continue this conversation that is starting here today throughout the primaries and then through the years to come. So I would hope that we could become the first trauma-informed city that would lead all citizens to becoming part of the next great city. So with that, I want to introduce David Thornburg, who is going to moderate this panel today. Thank you.
Thank you, Joe, and thanks for your leadership in pulling this terrific event together. And I know we all owe a debt of gratitude to our candidates. Having seen these folks for a number of times, I don't think you can appreciate how grueling but energizing this process is. And we're so glad you could all be here. And of course, thanks to all of you for filling this hall. I just wanted to offer a couple of thoughts about what brings us here today, and then kind of frame the conversation we hope to have over the next few minutes. First of all, you may be wondering what this character from the Committee of 70 is doing here, because as far as you maybe are concerned, Committee of 70 are those folks that turn out on election day to help you figure out what's going on, where your polling place is, and so forth and so on. Well, having been at the Committee of 70 for 4 months, I want to assure you that our mandate and our interests are much broader than that. In fact, they're probably aligned with yours. I mean, we're interested in not only well-run elections, but high-quality, competent, innovative, honest government, and a process, a reasoned, informed process that elects men and women to serve in public leadership roles. So I was delighted when I got talking with Joe and he asked me to moderate this discussion today. And I wanted to say a word about this, the set of issues that brings us here today, broadly health and human services. And a couple observations, most of which is deeply embedded in all of your lives and professional experience. I mean, clearly, we're talking about a set of issues that's first and foremost about people, about neighborhoods, about families, about kids, and about ourselves. This is a set of issues of great personal interest to me. I have a brother, Peter, with an intellectual disability, and my parents have been lifelong advocates around disability issues. So this is something I take to heart, as well as a set of issues that I know is fundamentally important to our city. We all share in this responsibility and in the goals that were articulated around health and human services. We all have people have friends, have brothers and sisters and relatives who either struggle with depression or have a disability, or we know someone with autism, and certainly all of us have to deal at some point or another with the effects of getting older, whether that's dealing with our parents getting older or as we approach our own years in that regard. So I think that's the obvious tie that binds all of us here today and all 1.5 million Philadelphians. Some of the work that Joe Pyle and the folks at Drexel have done recently, I think, is very fundamental in looking at this set of issues in another way, which is the economic impact on this city and our economy. Because much of the spending for health and human services comes from either the state or the federal taxpayers, although our wallets don't differentiate which check we write, there's an enormous inflow of money that comes into this economy that supports the health and human services aspect of what we do. The work that Joe worked with folks at Drexel suggests that just in terms of the behavioral health and intellectual disability, we spend about $1.1 billion a year, which has a $4 billion impact on the city's economy, supports about 25,000 jobs, and generates $36 million in taxes. So taking all the human elements away, which of course we wouldn't, that fact alone suggests that we should be paying close attention to this set of issues. The third reason is, and I think one that particularly resonates with the job that these folks are aspiring to, is we all know of the emotion and the political aspects of this very difficult job of helping people at various points in their lives with their lives. Whether that's the sometimes ugly NIMBY elements that arise in response to community facilities, whether that's the uncomfortableness and sometimes disdain we have for folks who are homeless or mentally ill. There's a lot of emotion and passion in a very emotional city that resonates around these issues. And I think one of the jobs that these folks are interviewing for is to lead us through difficult and sometimes emotional times. So again, no news to you, but unfortunately, it is news to much of the public and even the news media about how important these issues are. I've been to a number of forums, maybe some of like you, I'm on the stream of following the coverage of the mayor's events, and you have to look hard to find coverage of health and human service issues, despite the fact of their importance economically, socially, politically, and in human terms. So this forum, I think, is organized today to hear from these folks who, as we've said, are interviewing for a very significant job about what they have done, what they know about, and what they would hope to accomplish as the leader, as we've pointed out, of really the largest health and human services organization in this region. So we've set up this dialogue as a little bit of a job interview. We're going to be spending some time, as you do in a job interview, asking candidates about what they have done that would give us confidence that they're the right person to lead us. I'm going to listen to their responses and follow up with each one of them. And then in the latter part of our dialogue, we're going to give them a chance to project forward and say, you know, here's how I think about the current set of reforms, and here's what I'd like to accomplish if I were elected mayor. And then we'll have a chance for you to ask questions. The ubiquitous 3x5 card is at your seat, and I suspect Allie, where's Allie? Is going to be circulating, she's out there, is going to be circulating to pick those up. And so that'll be, she's working hard. That'll be the last part of the forum. So just to the particulars for the candidates, the first question that I'm going to ask, you're going to have 3 minutes to respond to. And our friend Luke here, right down in front, has got your timing device, so he'll let you know when you have a minute and you have 30 seconds. And the first question is this, and I told Mr. Diaz that we'd start with him. You're good? Okay. We're going to call an audible, and we're going to start with Mr. Kenny here. The first question is this, and this is, again, reflecting on their experience, their qualifications, and their knowledge in working with these issues. Question is, you've held leadership roles, all of you, in the public sector. So what can you tell us about your background, your accomplishments, and your insights that would make us confident in your ability to provide capable leadership around these health and human services issues? So, Mr. Kenny?
Thank you and good afternoon. Thanks for being here. When we're born, we're all born as human beings, and we all have certain talents and things that are not necessarily perfect in our world. And as we move forward through life as children and then as teenagers, young adults, and you get married, and you have children, and you get older and you go to work, there are things that happen in your life sometimes from the time you're a child when you had nothing, had no ability to stop it from happening, or if you're in a teenage or younger adult life and you've made decisions in your life that have put you on paths that have made your life less fulfilling than it could be. And as you get, or if you're born with physical or intellectual disabilities that make your life different, not less valued, but different than people who were born without them, we all as a group, as a community, need to help each other out and take care of each other. And we are, I mean, it sounds trite and cliche, but we are our brother and sister's keeper. And we need to use our strengths to help others that aren't as strong, and we need to use our intellect to best approach the problems that people face in their daily lives. And I'm a smart person, but I'm not the smartest person in this room. And I understand that living in Philadelphia, we have a great opportunity, and we're very lucky, to have the organizations, the institutions, the hospitals, the research, the social work folks who have done this day in and day out for years, have seen what works and have seen what doesn't work. And the government's responsibility, I think, is to be able to harness that intellect and that motivation and that experience to better deliver services to people who need them. And that's in every segment of our life. I had a paramedic friend of mine one time who told me that they had gone in to a building, to a high-rise building, to do another medical procedure on someone who's having a heart attack. And there was a little boy sitting in front of the television screen, and he seemed to be about maybe 2 years old. And he said he kept on looking at the child, and he recognized that there was no expression. He wasn't scared, he wasn't crying, he wasn't laughing. He was just in a maze, in a daze. And he wondered, what is that child going to be like when he is 15, 16, 18, 20? And that are the types of traumas that people have in their early years that affect what the type of people they are, what they do in their later years. It's our responsibility to make sure we kind of intersect that and do something about it and help people along their way. The government can't do that on their own. We need integration with the government and you and what your skills are and knowledge set are to better deliver services, scarce resources and economical services to people to make their lives reach the full potential that they were meant to reach when they came into the world. And that's my commitment as mayor, is to be able to deal with you and listen to what you have to say and try to do your best practices in delivering those services to our citizens.
Mr. Diaz?
As many of you know, is it working now? Yeah. As many of you know, I was born and raised in Harlem, and to some extent, I had a very humble beginning. I grew up in a house that was pretty much a sick bed. I slept in a sofa until I was 10 years old, and there was mold and mice and roaches and so forth, which affected my allergies. I had a caretaker that bathed me in cold water at a young age and got pneumonia, and then had asthma all through. And until I was 10 years old that I qualified for public housing was the time that I then started to get my body in shape. So I know what it takes in terms of having health and human services available to someone. That really changed my whole life. I had a room by myself. All of a sudden, I thought I was middle class because I'm living in a project on the 16th floor, looking out the window, watching the best basketball in the world. That gave me a reason to essentially go on. I had intervention in my life. I got involved in gang activities when I was there, so I got really strong. And I had the opportunity to have ministers and a guy who played in the major leagues, the Negro League, Leroy Otis, who helped me play ball, kept me off the streets, and the intervention in the ministry, Teen Challenge, helped me get out of the gang activity. And at 15 years old, school was still there for me, so I was able to transform myself from a very poor student to an A student, and the rest is history. And I've had the opportunity, in terms of doing that, to come to Philadelphia and start the Black Law Student Association, open schools there for the undergraduate program for Latinos and blacks. And also, I helped reform the court system. I took the court system and gave $100 million back to the citizens. Rendell was then mayor. I also was able to reform public housing. You know, God has a sense of humor. I get into public housing, and here I go to reform public housing. And that gave me an opportunity to make housing both for developers and for public housing to come together. And there are examples of that in Philadelphia and throughout the country. I also was able to work with Judge Doherty to help him in terms of reforming the juvenile system. And that juvenile system was really backlogged and really not working well. And as city solicitor, I was able to totally help him in reforming that juvenile system so there'd be some opportunity of success. And he always told me the real problem is education. If they had some education, things would have happened differently. And on, and some people don't like me to talk about that, but for 35 years, I work at APM. APM is a social service agency. I helped start ASE. I helped start North Square Civic Association. I helped start Congreso. So I've been involved in my community for 45 years to try to make things better for us. And based on that, I believe that I understand. Now, you said that you're not the smartest guy in here, but there's a guy who's really smart here, Dr. Evans, who has really been involved in these activities for a long, long time. I've seen him. I've seen each one of the organizations. One of the last things I want to say is that the mayor talked today about the fact that none of us had a plan for the school system. I have to tell you that if you look at my website, NelsonDiazForMayor.com, I have a plan, and that plan essentially works. So I don't know who he's talking about.
We're going to have to move on. Thanks. Ms. Abraham?
Well, I thank you all for coming. I'm delighted to accept your invitation to become the CEO of the region's largest health and human services organization. I happily accept.
We're still in the interview phase.
Okay. Yes, I understand. I'm trying to make points, and I'm not going to fall down.
I'll pick you up again. I'll hold you.
Drinking my water.
I'm the gentleman.
Yes, you are. I think the first thing that one has to understand is that like you, I understand what it's like to have the issues presented to us at a very early age. As a very young child, my mother was severely mentally ill and depressed. Manic depressive, mostly depressive, and it was a real difficult time. So for me, an adverse childhood incident was to see my mother in horrible distress and to be shunted from person to person where I was looked after and raised by other families, predominantly a wonderful Irish Catholic family who took care of me because my mother was ill. So I really came to understand mental illness and emotional distress at a very young age. I believe that my experience has really ideally suited me to take on these challenges. First as a judge, as a former baby prosecutor, then as a judge, and then as the district attorney of Philadelphia, I saw mental illness, behavioral issues, addiction, suicides, homicides, homelessness, alcoholism, the results of fetal alcoholism, drug abuse on an almost daily basis. Our jails had become the largest purveyor of mental health treatments, unfortunately, because of changes, sometimes not for the better, in our mental health treatment laws. And I've seen many people turned away from care because they either couldn't afford it or they didn't have any place to go or were poorly informed. In addition to that, I changed the Constitution of Pennsylvania to provide the change that was really much needed. When children see and experience traumatic events, sexual or otherwise, they had to testify in court eyeball to eyeball. I changed that so that children of trauma, homicide of others, sexual abuse, and so forth can testify on closed-circuit television in another room so that they wouldn't have to come face-to-face with their accusers. And that saved a lot of childhood trauma, mental illness, and God knows what else. In addition to that, I've worked closely with the Support Center of Child Advocacy, the Philadelphia Children's Alliance, and along with my partners, helped to have a co-location of all the rape crisis and sexual and domestic violence abuse handled in one place so that all the services, the police, the prosecutor, and all the service providers were co-located in one place So I know that my experience in these areas and others, and also conducted a number of investigations into the Department of Human Services, which we'll talk about later. So I know that my experience uniquely qualifies me to have the position of the CEO, and I hope my interview is finished. Thank you very much.
Mr. Oliver.
Good afternoon, everybody. I'm born and raised Philly boy, grew up in Germantown, single mom, and when we met several weeks ago with the coalition here, we talked about, it was new nomenclature for me, but we talked about adverse childhood experiences. And as I sat and I listened to all the different things that would qualify to be an ACE, I just kind of thought that was just growing up in Philly. I had no idea at the time really the impact that it had on me as a child and the things that I ultimately overcame. It reminded me that we can move past them. Regardless of how traumatic our experiences are, we can move past them. And one of the things about children, they're so resilient, they don't even know what they're facing sometimes. Sometimes if you've ever talked to a child who's been in therapy, they start to talk in therapeutic terms. It's very, very sad as we impose adult learnings on children, but starting out with the belief that we can move past these adverse childhood experiences is where to start. I grew up in Germantown, no father, no money, violent neighborhoods, poor schools. So I've lived these adverse childhood experiences. I attended Milton Hershey School, where for the first time all of these resources were poured into my life, and I realized the full village that it took to raise a child, and all of a sudden these resources were there and helped me get there. I had house parents, I had coaches, the financial resources, $15 billion endowment didn't hurt, and a reconstituted village were things that started to turn those early experiences around. It took some time, but we got there. As an adult, I've worked as a therapeutic support staff, TSS, in homes and in schools. I work for Child Care Information Services, helping parents overcoming barriers to employment. I worked under Estelle Richmond at the Pennsylvania Department of Public Welfare at the time, where she was a little bit ahead of the curve, but she was talking about serving people in their communities and starting to focus on prevention rather than triage in the back end and how much money you save because you invest rather than fix. I worked at PGW, pushing for low-income home energy assistance programs, and as I ride around neighborhoods on occasion with our FSD, our field services guys, you get to see the condition of homes, and you truly understand that what even I thought were adverse childhood experiences weren't compared to what they are now. And serving as press secretary for the city of Philadelphia during the worst economic crisis that the country has ever seen, and certainly the impact on an urban environment like ours, it was real all over again. And so I've seen these things as a user. I've seen them as an administrator. I've seen what's worked. I see what doesn't work. And I bring all of these resources and experiences to you as I present myself as a candidate for mayor of the city of Philadelphia. My platform is focused on education, jobs, and fairness. And I think much of what we'll talk about today is the issue around education, fairness, coordination, and ultimately investment, spending the money on the front end for the things that we know are important so we save millions on the back end. Thank you.
Mr. Williams.
Thank you, and thank you all for being here. I'm running on a platform of One Philadelphia, an inclusive vision that ensures excellent quality of life for everyone across the city of Philadelphia. Unfortunately, we don't have that right now. Your zip code, unfortunately, and your income and your status, your economic status, tends to define the quality of life that we have, and it's no more borne out in this area that we're going to talk about today. Your educational experience, your public health experience, your economic inclusion, all defined by zip codes and barriers across the city of Philadelphia. Without a focus upon integration and prevention, we will continue to treat everyone in these silos. I want you to understand that we currently, as a city and frankly as an administration, we incentivize collaboration. We operate in silos, insular ways of approaching issues, and we tend to focus upon narrow perspectives as opposed to broad concentration. Education, we should be much more involved in early experiences, identifying learning disabilities from infancy to 3 years old, so that the consequence of a child entering public school and finally learning that they are special needs, that investment is already made and prepared for us, that we can still save millions of dollars and frankly adequately serve children early in life. We should use evidence-based practices that address substance abuse and truancy. These are achievable standards that we should apply across all of these agencies. DHS and behavioral health, our systems and practices are not aligned. These two agencies are responsible for nearly $2 billion, and they don't operate together. We frankly spend more time on treatment and less time on prevention. If we invested more in prevention, then we would truly understand the outcomes for treatment would be less costly, but much more effective. Administrators who are intelligent, commissioners who are insightful, need to be appointed by the next mayor of the city of Philadelphia and allow them to run. But most importantly, demand that they work together. That they don't come to a mayor demanding that they get their budget consideration without the understanding that it has a consequence to another budget consideration. These investments have been borne out over years and years and years, and I don't think you're going to find that anything I say or anybody else says today is astounding. What you should know that is somebody actually knows about it. Some of the best teachers that all of us have learned from, Estelle Richmond, Ted Dallas. I'm privileged to have served in Harrisburg for many years. And frankly, they are extraordinarily gifted people in terms of teaching us what is necessary and how to do it. So I'm going to apply it. In addition to that, we're not going to argue about our slice of the pie. We're going to get more of the pie. We need to have a growth economy in the state and locally that we can allow ourselves the luxury of going to Harrisburg with a discussion truly about what we all need across the Commonwealth, certainly in Philadelphia County. So we're going to use technology. We're going to intervene earlier. We're going to focus upon treatment. We're going to focus upon prevention before treatment, allow us to have not just a vision, but an execution that many of you in this room have been frustrated for a long time about.
Thank you, Mr. Street.
I'm going to try that nobody thinks I have mental health issues because I can't recognize an X, which means you're finished. Okay. I was born and raised in Philadelphia. Went to church, and this is an important experience of mine, the 15th and Christian Street to the Seventh-day Adventist Church. When I was a young man, 16 years old, I was the youth leader of the church. I was involved in religion. I was preaching, heading the church, 5,000, 6,000 members. I left the church and went to Oakwood, went to Huntsville, Alabama, to Oakwood College. And we decided one time that we were going to leave the college and go over and visit the Seventh-day Adventist Church over in Huntsville. It was a church, it was a white Seventh-day Adventist church. It was my first experience with mental health issues. When we got there, the deacons and the elders were standing on the steps and saying, if you put one foot on this step, we're going to bash your heads in. I said, well, this is the church. You know, and it was at that point that I understood there was something wrong with some of these teachings in religion. So I come back to Philadelphia, and my campaign is based on the violence in the community. And I know there's something wrong when a 14-year-old shoots a man dead who's walking his dog. I know there's something wrong when people walk into a store and shoot a man who was trying to buy a gift for his child. I know that there's something wrong when a youth get on a bicycle and ride down the street and shoot a 3-year-old dead who's getting her hair combed. Now, there's mental health issues in the community as it relates to the violence that's going across this city, okay? I've been to community groups and I've sat down and I've talked to them. And when I listen to them, they've wrapped their whole belief into an ecclesiastical belief. And some people don't realize that the decisions that they are making are not, they're inconsistent with the norm because they believe one day there's a higher power that's going to take care of everything. Your child needs some help. Well, I'm going to pray about it. There's a higher power, and it's going to be all right. And that child ends up creating all kind of violence and stuff out in the community. I have a son, and I have 1 minute, who has, he's bipolar. And he has some issues. And he's on medicine. But the medicine does something to his personality. It does something feeling inside of him that he says, Dad, I can't take it. I don't feel like a person. I said, but you have to be able to process, son, so that you look at the end result. If you take it, the end result can be positive. If you don't take it, it's probably going to be disastrous. Okay? So you have to work through all those issues. Now, I have 30 seconds left, and I'm watching this thing right here. But there's a lot I want to say about stopping this. I'm finished.
Thank you. Okay, as promised, I'm going to double back to our candidates in order and follow up on their opening statement with and give them 1 minute to respond. So Mr. Kenny, you're a longtime city council person. You're aspiring to be the chief executive. They're very different roles. Can you give us one of the things you do as a chief executive is you bring together a team of people. Can you give us a specific example of when you were successful in bringing a team of people together to tackle a particularly tough issue?
Well, let me say for the outset that I think one of the things that a mayor needs to do in this particular environment is to figure out a way to make the public employees who perform duties in DHS and health and other departments less frightened of or resistant to the involvement of this community in their work. Because a lot of times what happens is the employees themselves feel it as if when we go to the private sector, they feel that there's a push and pull that they won't be in their jobs longer, and it's going to be the whole thing's going to be privatized. So you need to find a way to get those folks together so that they feel secure in their jobs and willing to do their jobs, and help them do those jobs better without that conflict. I mean, 30 seconds is not a lot of time to talk about. Oh, it's 2. I'm sorry, because
my mistake.
No, okay.
You get another minute.
Good. So my point is to try to deal with that tension that's in those departments as it relates to the outside community that are doing best practices and can help them do their jobs better. As far as bringing a team together, I mean, I think my staff is a perfect example of folks who have worked very hard within their areas of expertise to write legislation, to be able to draft legislation that's effective and actually changes things once it's passed. And I think, for example, marijuana decriminalization is a pretty good example of something that was very controversial kind of thing, but affected people's lives in such a way that the de minimis activity that many people have done, including myself, put them on a path to poverty and prison because of a criminal record. And I think that we've eliminated the possibilities or the probabilities that anyone doing that kind of making that mistake in their life will be on a path going forward to a terrible life by not being able to go to school with financial aid, not being able to go into the military, or not be able to hold a job or get a job. And I think that's an example of putting my legislative and social prowess together to get something accomplished that makes a difference.
Good. My apologies for confusing you on the time.
I'm confused on it.
Mr. Diaz, you mentioned a number of community organizations that were in the social services realm that you played a role in as a board member or as a founder. Can you pick one of those in particular and talk about an accomplishment or a major initiative that you were able to lead through that organization?
Yes, all of them have really had an impact. And you have to understand that this is personal to me because I had a brother-in-law die of an overdose, and I had many of my friends die of HIV or die of drugs in the housing projects where I grew up. Very few of us got out because there was an epidemic at the time. And so this is very personal to me. In 1973, I was involved in the governor's advisory board for drug and alcohol when the whole issue changed from being funded federally to be going through the state process of funding. And I started a bunch of behavioral activities, and then when Estelle got it into the CBH program, it was really a wonderful way in which you could attract to one organization and how she was able to give dynameters in terms of how they worked. And so APM is one organization that has not only done that, but they've become a real player in one of the decentralized forums that has been put together by the mayor in terms of providing services. And in providing those services, I've been there all along, whether it's the child foster care issue, whether it was the child adoption program, whether it was the addictive issues and the counseling programs. I developed some partnership between them and Temple University to be able to provide some of those services. And so I've been there all along the way for the last 35 years, being the person that was a thorn in Estelle's back to make sure that she continued to fund those programs in that community. And so it is so important because since it's so personal, I know what happens in that, and someone that has an addictive problem, whether it's cocaine or heroin, that high is something they never forget. And so you've got to provide some behavioral activities in order to supply and substitute for that individual so that that individual can function.
Thank you. Ms. Abraham, you talked about your mother's difficult experience and you experiencing that as a child. I guess one of the opportunities of leadership is to translate personal insights into changes, reforms, initiatives, hire people, fire people. So what would you abstract about your mother's treatment, about the way you saw the system work or not work, that you would bring to the job of mayor in this area?
I think that my entire picture of how we treat these issues informed by our background. Not only was my mother severely depressed and eventually committed suicide, but my nephew was severely hobbled by a multi-drug abusing background, and others in my family are on the autism spectrum. So I think you have to take all of your experiences and see how the system works or doesn't work. And looking at the system then and now, I see tremendous changes. When I saw my mother in mental hospitals, although they tried to be helpful, and I thought that what they were doing at the time was good, over the course of years, I learned that what they were trying to do to her was really cruel and inhumane. She was at Byberry State Hospital and Eastern Psychiatric Hospital and the Belmont Institute and every place else. So I know that humane treatment, better counseling with a triage of care, mental health, emotional well-being, psychological intervention, and targeted and appropriate drug therapy in a community setting is a much better alternative than anything that we've experienced. And becoming a judge and a district attorney and seeing our prisons become warehouses for mental and emotional illness is just the worst possible thing that we can do for our citizens. So that informs me as to how I'll approach this problem with great compassion and great understanding, and the idea being community-based, supportive, appropriate therapies, housing, and job counseling, and asking people to reach out to the citizens to offer them a helping hand through job placement, other services, and so forth.
Great, thank you. So, Mr. Oliver, you mentioned, and her name's come up a couple times, Estelle Richmond. I was with Estelle a week ago, actually. She was teaching, lecturing to a class that I teach at Fells, and we were talking about how she responded to crises. And she said, in the health and human services field, there will be a crisis. So if you were mayor, and it's not to pretend that it won't happen, or maybe you'll get lucky and get through all 4 years or 8 years or whatever. It will happen. So my question is, what have you learned in your experience to date about how you deal with a crisis in all of its challenging aspects?
Well, one of the things that I learned, and since we were talking about Estelle, I think we've all gathered from her, was her approach to problem solving. I'm not afraid to say that I learned a lot during my time working with her. One of the stories that she would always tell was a man walking along a riverbank who saw a baby in the water. He'd jump in and he'd save the baby. And then he'd see another, he'd jump in and save the baby. He'd jump in another, he'd save the baby. I think we have a crisis here. There's a bunch of babies in the water. But she'd say, rather than getting really good at jumping in the water to save babies, we should walk upstream and figure out who's putting them in. And so when I think about how to solve crisis, the first thing I do is try and differentiate between a core problem and a derivative problem. A lot of times we solve for symptoms, solving for the cough rather than solving for the pneumonia. And if you want to stop it, you have to find out what the root is. My campaign is based on education, job creation, and fairness. And the reason I picked education and job creation is because the crisis that we're experiencing here in Philadelphia, if you name 10 different issues that we're dealing with that make up that crisis, I think 8 of them are derivative challenges. There's really 2 core problems, and that is education and job creation. The reason everybody's gathered in this room is because when we look at education, why it's not working, there's all sorts of reasons why it's not working, and much of it is in the home. Much of it is in the neighborhoods. So as I think about how I would address crisis, I try and identify the root problem, solve for the root problem, and gather the right people with the right resources and the right information and know-how into a room to kind of figure out how to start there.
I want to encourage you all to be thinking about your questions, putting them down 3 by 5, giving the high sign to the folks that are collecting them, because pretty soon we're gonna go to you. Mr. Williams, you raised this question in your remarks about breaking down silos, which is endemic to this area of government as to many others. What have you learned in your public service that works or doesn't work? That works. Let's keep on the positive. What works? What works to tackle that long-standing, persistent challenge?
So you want to identify the areas that are most of concern, and then you want to identify the things that are common. There are going to always be issues that you differ with. I'm a happily married man for 20 years, and I go home every day, and I'm quite clear that I don't lose many of the debates or arguments in my household, so we have disagreements. But we're married 20 years because we find consensus. And in this particular area, because people tend to be so passionate, and frankly, it comes either through their training, their clinical experience, their mentor, they believe in a solution, and they're driven towards that solution passionately. And sometimes that encumbers their ability to frankly face the facts differently. And so, especially in these categories that we're talking about today, they are very human being driven, and people want to fix those human beings directly. And so they believe and attach to. And I will tell you that all of us up here have had experiences in our families and our lives that are housed in this room. I was particularly impacted upon Lynn's commentary and forthrightness about her mom. I can't tell you I'll be that forthright with regard to some of my own personal experiences, but I can identify with the passion. But the reality is the constraints of finances, the regulations, the policies, and the politics are things that you all really get banged around. And so frankly, what I've learned is to build around the realities. And in this space, we're going to have to build around realities. We're going to have to use technology. We're going to have to use best practices that produce outcomes, whether we agree with them or not, because we're getting money from people who don't necessarily look at anything other than outcomes. We're going to have to be nimble and adapt to changing applications that are nationally renowned. We're going to also have to accept we do things differently. And we're going to have to do it in terms of a linear, not vertical. Silos removed, but in integrated services. All departments, even beyond Health and Human Services, impact this community. And so we have to be open to those experiences.
Great. Mr. Street, you've interviewed for this job before, and so I presume you've given this some thought. You've been a longtime community activist, and you have a clear sense of how people's environment affects their lives and brings about some of the challenges we're talking about. Being mayor is different than being a community activist. You have different levers to pull. So I'm just interested in your thoughts about how you would manage a different leadership role to try to achieve the kinds of things you want to achieve.
Well, first of all, let me see if I can ask you this question, because it's in my mind. I go into the community, Kensington Avenue and all these avenues, and I look at all these recovery houses and whatnot. And the question I ask myself, is the mental health issue bigger than our ability, because of its numbers, to be able to actually cure it? Because the way we're dealing with it now, we're perpetuating mental health. We're not curing mental health. And you can't know that by trying to deal with it from a distance. I would suggest that some of us at some point walk up and down Kensington Avenue and walk up and down some of these avenues and go into some of these places that are called recovery house or called mental houses to report and watch how it works. And it does nothing. So we're wasting money. We're wasting money. The first thing I would do is I would admit I am not an individual who can cure this problem. I have to talk to the experts, the people who have the ability, the expertise, the experience, people who have applied at some point in their life every test known to reason, knowledge, and experience to come to the conclusions that they have around this mental health issue. We have 1.5 million people in the city of Philadelphia. How many of them out there in these poor communities are suffering with mental health issues? Is it that the mental health department has not done a good job, or has it done a good job on a portion and we don't zero in on those that they've done a good job on? We zero in on all those that they have been the inability to reach because of the capacity of their workforce and because of the great numbers of people that are out there. So I would have to get all that information, but I would turn all of this into the hands of forming an advisory board to go through a search, find the best people possible to deal with this. I'm finished.
Thank you. Okay, there's a couple of questions from the crowd, and I'm just going to maybe throw these out there. No need for any of you, for all of you to respond, but certainly give you all the opportunity if you want to. So the first question from the crowd is, how will your administration build on what's working while also increasing coordination and strategic alignment of investments for children? Mr. Williams? Yep.
Any minute? Okay, thank you. So, hiring the right people. So commissioners are very important in this area. So when you ask me about how do you align those relationships, you have to have people who are smart, intelligent, knowledgeable, but are committed to collaboration. Then you have to provide them with an adequate budget. It will not be an extraordinary budget. And tell them it is collectively shared, not just insularly shared. Then we're going to provide technology and information. And the most significant thing is that we're going to computerize, we're going to use technology across departments, not just in this space. Police department, educational experience, DHS, a variety of others, so that when you're dealing with these problems, you're dealing with a complete and whole person, and we have knowledge of them. So those are the ways I would approach it.
Great. Mr. Diaz?
I don't know if they always put my mic on last for some reason, you know. I don't know if people realize that between the ages of 3 and 8 is when most children really learn. And as a result of that, there's a lot of toxic stress that occurs in a family situation, which, you know, I was lucky at 15 to be able to recover. But there are a lot of folks at that age that doesn't recover. So you've got to really invest early on children and children issues. The studies have said that if you can take a kid out of that situation and get a kid into thinking and believing that he's special, he will begin becoming special and act like special and provide all of the support necessary to get into a frame of education and hope to continue and become a child that will enter into a workable situation. And also the family. The family needs to be able to have some dignity in having jobs and having relationships that essentially are correlated and supported by some behavioral organizations, whether it is drug abuse or other issues that occur in the family.
Thank you. Mr. Kenny?
I think that every department and every function of government that deals and interacts with people, the employees of those departments need to have some kind of training. It doesn't have to be the extensive training that DHS folks have or that health department folks have or the people who work for your organizations have. What people in the recreation department and in other departments that interact in the schools, that interact with people every day of every age, need to have some knowledge, sensitivity, training, minimal as it may be, in what to look for, how to deal with people, how to interact with people. And I think a lot of those things have to do with not knowing how to interact with people who are expressing kinds of behavior that are confusing to people and sometimes they feel in danger about. And I think having those educational resources and training would be helpful in delivering government services across the board.
Great. Let me refresh the question, see if there are any other takers. How will your administration build on what's working while also increasing coordination and strategic alignment of investments for children? Anybody else? Oh, Ms. Abraham, looks like, okay.
He came in first.
Okay. Mr. Oliver, go ahead.
As I mentioned earlier, one of the themes of my platform, in addition to being schools, jobs, and fairness, was the idea of investment and coordination. I think both of those things are addressed in the question. One of the things that's always frustrated me is that we look at ourselves in silos, and oftentimes when we think of silos, we think of them in individual departments. But in between, interagency silos exist as well. A lot of times the water department looks at the water department's budget. DHS looks at DHS's budget. I have to speed this up. At the end of the day, I'd like to take a look at all existing city agencies and the role that they play in changing educational outcomes in the home, but from their budget. We look at the school district's budget at $2.5 billion, but I'd rather look at the total budget of $6.5 by the time we add in the city's 3.9. Looking at all the different nonprofits that are funded, a lot of different social service agencies that are funded. They are funded in one-offs and they do good work individually, but the work that they could do would be much better done if coordinated collectively.
Thank you. Ms. Abraham?
One of the things that we really paid attention to as district attorney and social workers and health care providers is youth violence. So when youth violence really reached its tremendous peak, we had some people come in, sit around the table, all of the stakeholders, and we came up with a plan called the Youth Violence Reduction Partnership. That was data-driven, and it was a result of mental health workers, social workers, homicide investigators, drug and alcohol providers, and the like. And we came up with a strategy of how to coordinate all of our efforts so we could target and identify those youths who were most likely to either kill or be killed. And these were mental health components, drug addiction components, and the like. So by coordinating all of those efforts and bringing all the stakeholders together and sitting around the table and then thinking about a program that just might work, we put it into effect, and it was enormously effective in targeting youth violence and tamping it down, if not eliminating it in many areas.
Great. We're going to call another audible here. We have a terrific group of about 20 questions, but if it's okay with you, we're going to send those to you. And if you'd be willing to share your responses, I know we'll do our best to circulate those. So now I'm going to move to the last part of the program, which is to give each of you a couple of minutes to sum up your thoughts about where you would see your leadership of these efforts in health and human services going forward. And as we suggested to you in preparation for this, we would like you to address some of the recent reform efforts around decentralizing child welfare, improving implementing the Improving Outcomes for Children model, and moving services from state hospitals and larger institutions to community-based providers. So if you could take a shot at working those into your answers about how you go forward, that would be terrific. And we'll go in reverse order. Again, 2 minutes, and Mr. Street.
Yes. I don't have nearly enough information to come to a conclusion as to a specific strategy that would be taken. I would be sitting up here merely trying to say, oh, you can vote for me, by telling you something that I'm just talking. But what you have to do is identify, what I would do is, I have to identify the problem. We can talk about the infection, but until we get to the splinter, the infection is going to continue. We can put Band-Aids on the splinter, on the infection or whatever's causing it. But I think from my experience, we have to go back to prenatal care. We have to go all the way back. We have babies having babies out there in the community. And when those babies are born, they get absolutely minimal amount of type of medical care, and from A to Z, even from nutritional food, which many times results in mental health issues. So you start and you have another generation coming along, and it's going to continue to perpetuate itself. So you have to have a starting point that's going to be a starting point that's not going to allow it to continue as you go forward. It's not going to continue to perpetuate itself behind you as you're going forward. So again, and in closing, you need a extremely experienced and educated staff who are experts in this whole mental health issue, and I would do everything in my power to make sure that we've done a real good search for talent search, and that we've come up with the best available to be able to tackle this enormous problem in the city of Philadelphia and the surrounding counties.
Thank you. Mr. Williams?
This closing statement should attach ourselves to real life experiences that we all go through. Recently, we were all invited, all of us, elected officials were invited to a room of hotel general managers talking about conventions coming to Philadelphia. The question was posed to us about how we handle panhandlers, those people who are bothering us. In this room, everybody should have an answer to that. And by the way, some of us have a record. The question for me is, and I was asked, and I guess they thought I was going to talk about getting the police to arrest people. So my first comment was, most of those people have mental health impairments. How we've addressed them in real life terms. DNC is going to come in here. Can you imagine we arrest away the problem? As opposed to organizing ourselves through these departments before they land here. Who's having that conversation so we're not confronted with this problem? These are real world moments. When we have these occurrences and people say they act out on a SEPTA bus or they're eventful on a weekend, this directly correlates to the lack of connectivity that we have in government that serves online with a police department or someone or a SEPTA driver who they don't have information to service that need. My administration will align that in real ways, not artificial conversation. I could talk about Estelle Richmond, everybody else till the cows come home. The question is, at 3 o'clock in the morning on a Saturday, when everybody's at home, what will they experience from this administration? That's what this is about.
Thank you. Mr. Oliver?
Thank you for the opportunity to come out and talk today. I think a Doug Oliver administration would be focused on providing trauma-aware leadership. Really, put differently, just empathy, understanding what the challenges are that our city faces. We talk about one city. I'd say right now we have two cities. We have those that have, we have those that don't, and the reason that those that don't have is because of education and jobs. But again, the challenges that cause that poor education and lack of jobs, lack of employment opportunities are great and many, but so many of them are in the homes and so many are solved by people in this room who deal with it every single day. For that reason, my platform will remain the same, focused on education and jobs, but again, coordination and investment on the front end will be the hallmark. Understanding that kids don't learn in school sometimes, the reasons that they don't learn in school sometimes have nothing to do with the teachers, have nothing to do with the books or their capacity or ability to learn. It's other things that they're wrestling with at home, including domestic violence, neglect, sometimes poor nutrition, certainly violence, substance abuse, you name it, they're dealing with it. So just understanding that will cause us to make different decisions as leaders. And again, we're talking about a system here. If you're talking about how to stay healthy, some would say eat well, exercise, and sleep a lot. But you don't make up for not eating well and exercise by sleeping all day. So we can't invest all of our energy into one specific area. We have to rise all boats with the tide. We have to focus on a lot of things. We have to walk and chew gum at the same time. And for that reason, finding jobs for ex-offenders and rebuilding families are all parts of the solutions that we seek when we talk again about education, jobs, and fairness. With my last couple seconds, I invite you all to stay aware and awake. We are going to be announcing an addendum to our education policy called Homework. That press conference will be next week, and we will be talking about our plans to address the challenges in the home that address our children's challenges around learning.
Thank you. Ms. Abraham?
Is this the closing statement?
Yeah,
It's
sure
a
is.
closing
Yep.
statement. Oh, okay. Sorry about that. I was talking. Well, I think that probably one of the best things that we can do as mayor is talk about the issues of child welfare. Everything starts and ends with early childhood education, early child development, preschool, and the like. And we find that as a result, for example, of my investigation into the Department of Human Services and two in particular tragedies of the ones that many that I investigated, the Danielle Kelly case and the Tara M case, that we became informed that community-based treatment is the best way to go, and that a decentralized version of of care with seasoned, with well-trained and well-informed and science and experience-based treatment providers is the best way to go. And our outcomes for children are better when there is a whole cadre, a whole team approach to child wellness. And that includes mental health, substance abuse, domestic violence, starvation, alcoholism, trauma in the homes, and the like. And we work best when we take the care and the compassion by introducing great treatment providers who worked for me, like the University of Pennsylvania School of Social Work, and psychologists like Sarah K. Smullins, who really take the individual child and figure out how we can best treat that person. So on the basis of everything that I've known and the vast experiences I've had, the funding issue for the city is always going to be a challenge, but a person who's had broad and deep experience in every aspect of mental health, rape crisis, trauma, homicides, suicide, domestic violence, and everything else. I think on balance that an Abraham administration will be able to meet many of the challenges but not solve them all. But it has to be done on a teamwork approach and with an open mind and an open heart and a compassionate approach to treatment and care.
Thank you. Mr. Diaz?
One of the things that I don't know if a lot of folks understand, we've had 2 killings in my community just recently. Wilfredo Rojas' son was killed for no reason. Somebody coming out of the club and killed him. My wife's closest friend, Maria, her nephew was walking down the street, and they shot him as he was smoking a cigarette. No reason at all, just target practice. My good mentor, whose name I won't mention here because you'll know who it is, and his daughter, who had mental illness, had been held in custody for a while in terms of mental illness. She got out, she got a gun easily in any gun shop and killed herself. I mean, there are things that the law should be able to do to limit the availability of guns, for example, so people can sort of survive. People don't understand that there's so much trauma in our communities that you have to essentially be able to work with you in partnership so that we can go out there and support. I'm glad that Tony Williams the other day used the wraparound system that I've been talking about with regard to being able to help a group of young people and children so that they can be prepared to function in a society. And without your help and without your participation, that's not going to happen. So I will try to do everything I can to learn more about what you can teach me so that I can be there with you and work within our community and try to help stop the trauma. If we can stop the trauma, if we can help them early on in childhood, then we can get there to adulthood. But if we don't do that, we're going to continue to pay later for the issues that we have now. $30,000 per person in prison. I'd rather use the $30,000 per person with you so that you can help with the resources that we need to have a behavioral health issues in terms of our community. I live it every day. I know it every day.
Thank you. Mr. Kinney?
Thank you very much for the opportunity to be here. My life in politics and government has been one of evolution and revelation. We have ideas that we think are so secure and solid about people's issues and problems, and you learn if you keep your mind and your heart open that you change as you go forward. I remember Sister Mary Scullion putting in Project Home at 15th and Fairmount, and the hue and cry that was going on as a result of community opposition, and the world was coming to an end, and our housing values were going to plummet. And about a year or so ago, I saw 3 or 4 townhouses directly attached to Project Home that were selling for $450,000. And I called her on the phone and said, thank you for raising our property values by having such a wonderful institution and service in our community. When it comes to issues like addiction, we have our true, solid attitudes about addiction, about methadone use and dispensation, and where it should be done, and understanding that people, if they're not using the methadone or getting the methadone, they're going to be on heroin again, and they're going to be worse. They can't function. And where do these places go? Where do you place them? And I think what a government can do the most is educate people in the community as to the benefits of community approach to these kinds of issues and problems, and not to be afraid of people because they're different or because they scare you. Sister Mary always said to me, when someone on the street asks you for money and you don't want to give it to them, look them in the eye and tell them, no, I can't help you today, as opposed to walking by them and having nothing to say to them. And if you learn as you go through life, from people like yourselves who have the experience. You keep your mind open, you keep your department being able to pivot, and you hire the right people, the right dependable people who have a good heart also, who will listen to you and your experience and make lives better, allowing all of us to reach our potential.
Well, thank you very much. And thanks again to our candidates. We'll see you again. Thanks to all of you for your leadership and energy and good works. Thanks for the Scattergood Foundation, and we'll see you soon.